Hi, I'm Dr. Michael Jarman with Pediatric Foot and Ankle, here today to discuss toe walking in our children. This is an 8-year-old little boy. He has severe toe walking. He's exhausted all conservative care with splinting and bracing and physical therapy and the watch and wait. He is pretty bad. He's not able to even get his heels down to the ground. He's had this his whole life. This is not an issue that's just suddenly happened and he started toe walking. He's just never been able to walk normal. These kids struggle a lot with fatigue and pain. The majority of these kids that are this severe have an anatomical variation in the back of their leg that don't allow the Achilles tendon to grow and lengthen normally over the years. And it creates this tightness, this rigidity in the ankle joint. This is shown here because this he's asleep and I'm about to do surgery here. And as I flex his ankle, you can see it's just completely locked up. This is 6 weeks after surgery. I lengthened the Achilles and I removed that anatomical abnormality. And immediately what you notice, so this leg obviously hasn't been done, but that right leg, you immediately notice is that there's a restoration of the range of motion within that ankle joint. These kids don't have pain post-operatively after this. They're guarded, and you can see here, this is week 6. He was in a cast for 4 weeks. I then transitioned him into a boot for 2 weeks, and then at 2 weeks, we actually want them coming out of that boot and back into regular shoes. And then the other leg, we'll stage that 2.5 months out. Now, in some of these kids that are really severe, like he is, we sometimes will move up that surgical date on the other foot. Instead of waiting 2.5 months, we sometimes will move it up to 2 months, just so that we can get them moving along a little quicker. But they have to be staged 1 foot at a time. So you can see here is 14 weeks out. Both legs have been done. The correction is very pronounced, or it's really good. You can see that he has kind of a, I won't say heel toe, but he can actually put pressure on the heels, and he's able to try to walk flat. We typically are having them do physical therapy immediately post-operatively to help increase range of motion and desensitize. Here's 5 months out. You can see these surgical incision sites. This isn't normal, by the way, when we look at these incision sites. They're typically even. He had a variation on the back of the leg, making one surgical incision site just a little bit higher than the other, but they're typically at the same height across the legs. But what's important to notice here is that his gait is completely changed. He has now a more normal heel-toe gait. He's still guarded. Every child, again, is very different. Some of these kids don't have much restrictions or much limitations when they start to walk, and then some do have a little bit of a slower progression. This kid's a rock star. He's doing awesome, just killing it. So 5 months out, I mean, he's walking like he's never walked like this ever in his life, right? We saw how bad he was here before surgery. He could never even get his heels down, and now then post-operatively he's able to get his heels down. Just, it's life-changing for these kids. If your child toe walks and you'd like to explore a pathway to correct their toe walking, whether you're here local or out of state, feel free to give our office a call. We'd love to help. I'm Dr. Michael Jarman. Thanks for watching.